Hello, hello, hello. Hello, everyone. Brilliant to see everyone enjoying the wonderful sunshine. We put that on especially for today, so absolutely grateful that you're able to enjoy it. Amazing hospitality today as well. I know you're all enjoying the bar as well. If you can and you want to, please do settle down. We're going to have a little bit of a panel discussion now, which will be hopefully a little bit interactive as well, definitely informative, and getting a lot out of what has been presented already. So you're more than welcome to stand, or if you want to settle down now, please do join us. So first and foremost, my name is Vishal Shah. I am a trustee of Care England and treasurer of Care England. I sit on the board of Log My Care as well. I'm also the chair of something called Championing Social Care. And when I have some spare time, I'm also the founder and CEO of Banyan Care, an operator. So, and I'm today delighted to actually build on what hopefully has been already a great afternoon so far as well. Some really great information being shared. And I will be now, for the next hour, we have a wonderful panel discussion. I'm joined by an esteemed panel, which I'll shortly be inviting them to also give their introductions. But before I do that, what we have here, and I'm hoping everyone's got their copy of their report, and really hold it with great regard. It is an incredible report, and it is an incredibly detailed and extensive report. This is a topic that hasn't really been covered in the depth that it has in this report, and yet families are so central to the services that we provide, the care that we have across the whole sector. And yet it doesn't always get done right. It's hard to sometimes build that relationship there, yet they're being so central to it. So I would implore you, if you haven't already, take this away, really read it back to back, and there's some great insights in there. However, I know that we're also joined with a wonderful room here of experienced senior leaders and professionals within the sector that are already doing this on the front line in terms of care services. And what we wanted to do in this panel today was really bring out maybe the life of that report, a little bit in the context of actually there's all these providers and senior leaders within the sector. What is the sort of implications, the applications, the great opportunities, as well as some of the challenges that have around this topic of family confidence in particular. And with our panel here today, we'll be delving into some great questions. In terms of format, we'll have a bit of a conversation. It is a nice conversation. We're sitting on high chairs now and high stools, so hopefully you can see us and it feels like we're just having a nice chat in a bar, which is great. So we'll explore a few things and topics. There is also some opportunity at the end, so allow us some time towards the end for your questions as well, which I'm hoping maybe there'll be some spurring as we even discuss some of the topics today. But do hold those questions, because we'd love to get those also brought on board. And then there'll be a bit of hand movement I'm going to ask you to do, because I don't want you just sitting there as well, just sitting still. So the first question I'm going to ask you, also get your hands moving, so to make sure that they're working really well. Okay, just to get a sense of the room right now, before we introduce our panel, how many of us are sort of have service or supporting people, largely the younger adults within the social? Put your hand up really, really hard. So if you've got services that are supporting younger adults. Okay, brilliant. Put your hands down. What about those that are supporting older adults? If you have any providers there? Okay, brilliant. And some are maybe doing both as well, so that's great as well. How many of those are just supporting the sector through services, technology, maybe some solutions? You can put your hand up as well. Brilliant. Well, hopefully you've also got a sense of the room now in our panel as well, but we've got a great mix of people within the sector as well, and this topic really hits all those strands as well. So hopefully we'll get a really engaged discussion going forward. So I've done a lot of talking, which clearly I will continue to do if you don't stop me. But I'm going to now invite, obviously, a wonderful panel here. If you can just introduce yourselves wonderfully. And I'm going to ask you, because I know you've read the report back to back, and I'm sure you have, and you've loved it. In fact, many of you contributed to it as well. But was there a particular statistic that caught your eye in that report? So at the end of the introduction, maybe you can share that as you do that. Brilliant.
Me first.
Oh, if you don't mind.
Okay. I'm Cathy Williams, and I work as the head of regulation and care compliance for Fulcrum Care Consulting, the consultancy business. My career background is I'm a nurse originally, and I've worked in CQC and other UK regulators in lots of roles, from inspector through to national director. And I do a lot of expert witness work when things go wrong. So that's my background. And my favourite thing, so my favourite bit about it was not so much the report, but Sam's talk, where he was talking about the different levels that you can provide to families, because I think that's a huge challenge, and it's a huge kind of misconception from people that you have to give them everything. And I think having that different, so for me, that was a big takeaway.
Brilliant. Well, we'll delve into that a bit further. Please.
Hi, I'm Martin. I'm the Director of Operations at Wilf Ward Family Trust and also the Chief Operating Officer at something called Kingdoms of Care Limited. We support adults with disability and complex healthcare needs in the main, all ages. I have spent the vast majority of my career working in the third sector. My spiritual home is Northern Charities that need a little bit of love in terms of quality and finances. But also I've had 5 or 6 years in interim and consultancy roles in the Middle East around big healthcare systems. And the thing that really struck me, although there were so many things in it, was that 8% of families only get contact when something bad happens. And that's like mercifully low, but also too damned high at the same time. So that really struck me. And we are just rolling out Log My Care currently in the organisation I'm in. And it's real food for thought around how we manage that.
Fantastic. Brilliant. Yeah.
Hi everybody, I'm Laura Bywater. I run an organisation in Kent providing specialist care for people with learning disability, mental health and autism. Like everyone else, I also wear other hats. So I'm also on board of directors for the Outstanding Society and for the Kent Integrated Care Alliance. So do have contact with a lot of providers and good to see so many of you here today. In terms of the report, I think for me, I'm going to go slightly broader if I may, Vishal, and say that actually it's a real luxury. It's really good to have a bed of data and information that actually validates those hunches that we all walk around with and have and feel and think we know. So to actually be able to finish that with some really good numbers and helps us prepare for how we should be moving forward.
Brilliant. Fantastic.
And hi everybody, I'm Katie Thorne. I'm Director of Innovation at the Digital Care Hub. We're a not-for-profit that provides free support to adult social care providers around England on anything to do with tech, data protection, cyber security. My background in the sector is working mainly in nursing homes, both as a carer and in operations, quality and compliance, so focusing on dementia care and end of life. And this report's really sort of meaningful to me as well. So I also was a family carer for my grandmother, so I was a living carer with her until she went into a nursing home, so have experience as a family member going through that, having control day to day where you see everything, and then sort of navigating that sort of change in relationship when you have a loved one going into care service. So there's so much in this report, which I think is really great. Martin stole the quote that I was going to in terms of the stat. So as somebody who's worked sort of specifically in the digital space, it was something in Martin's forward actually that really stood out to me, that this isn't about technology. This is about leadership, it's about transparency and humanity and the values of care and how we can make sure that that really includes families. So.
Fantastic. It's brilliant. Look, as you can appreciate, we have a wonderful panel here that are going to delve into some incredible nuggets from this report as well and see the practical implication. I think this is brilliant. And thank you for sharing those values that you personally have taken from the report. And I'm sure there's many that can be shared across this room as well. So make sure you get your hands ready for that as well. So let's delve into a few questions if you don't mind, because I think there were some really pertinent statistics that came out from this report as well, which I think, you know, as you say, there was something about validating what sometimes is a bit of a hunch. But when you put that validation to play, those statistics can be quite stark, actually, in thinking of, you know, do they really mean that? So the first one was that it talked about the fact that 70% of families want daily updates. And, you know, that is a task in its own right, yet only 51% of them actually receive them. And this is maybe a question for, we're all, as you say, a majority of this room actually provide care services. And we know that, as Martin alluded to earlier, that, you know, there are as much opportunity in the sector, are the challenges as well, particularly around workforce, around other areas of funding. Certainly there are a lot of regulatory pressures that come onto running services. So from a leadership perspective, you know, what breaks down between the intention to communicate consistently and the reality of delivering it? I think we have this little problem as well, where we have to try and build that reality into place. So particularly when there are stretched services. So I'm going to come to you, Martin, first, if you don't mind, because I know there's a really interesting case study already in the report. We talked about, quite honestly, about the experience that you guys have had around family communication, and this particular point about 70% of families want daily updates. If you don't mind sharing your thoughts on this particular topic, how leaders can.
Yeah. So for me, and you know, there's much more knowledge and experience in the room than I have. So it's just my view, really. There's always good intent around this stuff, and we'll even agree with families and it'll get into a nice rhythm, and some days go beautifully for the individuals we support and our colleagues, but delivery care is messy some days, and like the road to hell's paved with good intentions. So like communication falls away at the point, slightly understaffed, got agency colleagues who aren't necessarily pulling the weight, we don't have a driver, the individual we support wakes up and their day isn't going that well. Delivery care is messy, and at that point, it's not just about getting through the day. That would be doing a real disservice to the incredible job that support workers do, but it's much more focused on potentially clinical need, making sure the person's well, getting through the day, and we all want to communicate with families, but it falls away as an afterthought. There's just one other thing in terms of that leadership space. It's like the psychological security and the climate and culture we create for our colleagues. Because in communicating with families, we'll agree exactly what you can and can't and where you can use your judgment and creativity. But that's scary for support workers. What if I get it wrong? And they're worried about sharing something they shouldn't, or not doing it in the right way. So as leaders up and down a business, we have to walk the talk on, we're going to get it wrong sometimes. And it's an opportunity to learn and do something different, as long as nobody dies. And then we don't jump all over the support worker who's on the thick end of this. The report's really clear. Families are saying they'd rather hear from the person delivering the care than anybody else. And there's things that go with that. So we as leaders need to create the right climate for that.
Most definitely. I mean, I think there is definitely that intention, certainly that, whilst have busy days, it's not the case that it's not intentional to want to communicate, but it just doesn't sometimes always hit the mark being able to do that. Hence that 51% don't necessarily get the updates. Laura, do you have any experiences from the services you run as well where...
Families are key. And I kind of want to say something that might land slightly awkwardly, but again, it's with good intent. And that is actually, particularly working with working age adults, we also need to remember that they may not want everything that they're doing every day communicated with their people, their family, their loved ones. So there's a kind of, we've got a broker between the person receiving the support, what they're comfortable with being shared, because when I was in my 20s, I want my mum and dad to know what I'd had for breakfast and whether I'd been to the pub and whether I bought something off the top shelf of the newsagent and all of those things. They want to live their lives without feeling that they've got to be accountable to their families. So I think it's really important that we find a way that families can have that confidence and know what's going on for their person without invading their privacy and without breaking down that trust between the person receiving support and their team. Because what we don't want to do is feel like a team is misusing, potentially, information to undermine the decisions that person is making. So I think it's quite complex. And I think it's something that we have to really, it goes back to what you were saying around giving the teams, our colleagues who are working on the front line, the skills to be able to have those conversations, to know what's appropriate. And actually, sometimes it might be the person doesn't want us to tell you anything today, but delivering that in a way that doesn't put people's hackles up, that makes people still feel involved, giving them some appropriate context to it. So I think it's a really complex conundrum that we have, and we're able to design this with people. And as we always say, every single one of us in this room will say, one size does not fit all. We have to design each of those contracts, if you like, with the individual, with those families and with those teams, which is blinking hard work. But getting it right hopefully means that better communication happens, and because we are in a position where we're hopefully sharing really positive things most of the time, on those occasions where the more difficult conversations happen, it's not the awkward, if anybody's ever had kids and you see the school pop up on your phone and think, oh my God, why is the school phoning me? We don't want to create that situation for families. We want it to be a positive experience, even when it's a bad day.
I'll open up as well, because I think that whilst we may feel that, it is quite complex, as you say, that we're all represented in this room by people supporting at different demographics and different parts of the sector as well. So they have their own nuances as well in terms of how communication should matter. But still, 51% is still a statistic that means that 51% are still doing some sort of daily update. You can share some, some good examples where you've seen where actually these daily updates have worked well. And
I've got an example that sort of piggybacks on Lara's a little bit. And I think it shows, actually, if you've got strength in your convictions and you can back them up. We're talking about young, working age adults, but let's not exclude the older population, because actually, I'm not sure I'd want my daughter to know how many times I'd gone to the toilet in a day when I was 80. And we've got a situation with a home that we're supporting where she was estranged from her mother, and we were very clear her mother would not want her to have the level of detail she wants. And we've stuck with that, and we've supported the provider, and she's gone to everywhere you can imagine, CQC, safeguarding, etc. But we've stuck with it, and we've stuck with the reason. Everything was involved as it should be, independent advocate. So I think it's really important that we don't just kind of, I don't know what the word is, kind of take away those rights, even when people are older. Because I think we have got a propensity sometimes to think of them as not having the right to privacy, and we have to give the family everything, which is great. There's a degree that needs to be, I think, reached in all of the situations where everyone's comfortable and it's respecting everyone's rights.
That's brilliant. Did you want to add something, Katie, as well?
Yeah, sure, just very briefly, and not to be the person bringing up GDPR. I know everyone really wants to every time. I promise there's more beer if you sit through the data protection bit for a minute. But I think it's adding on to the complexity that sort of Kathy was just mentioning there, right, in terms of making sure we're respecting people's rights. And then you also have the converse of that when the frontline care teams, it's hard enough for senior leadership to sort of navigate all of the different bodies who can be involved and where we can share data and where we can't. And still very frequently, I think we talk a lot to frontline care staff that they feel very, very concerned about data protection. They're really worried that they're going to overstep, they're going to overshare, and they're going to be in trouble. And so I think from a leadership perspective, we need to be considering that concern that, our frontline staff has, that they're doing something wrong. And, that's about empowering them to have trust in themselves, that, they know what's right for that individual, they know the information, and they know where to go for help. And I just think, in something which is so tightly regulated as a sector, we can't underestimate how that can make staff feel sometimes.
Yeah. It is not an easy answer to this question, actually, in terms of there is almost a willingness, but also a complexity to how we actually consider how to build that relationship with families. And I think that's kind of demonstrated a little bit here, that there are multiple stakeholders involved in that communication channel, which we have to think about in that regard. But just to bring it out to the room a little bit, I'd just love to know, maybe from the room, if you could just put your hand up, how many of you feel pretty confident in this room that you are able to, maybe achieve, or you have a system in place that gives at least some quality of daily update to families right now? Do you feel fairly confident that you have something in place right now that gives it? Okay, it's interesting. The hands are not quite confidently coming up, but there's a little bit of a wavering hand, and maybe it's something to reflect on. Is it? And it'd be lovely to maybe explore this further a little bit in terms of what are the difficulties as providers that maybe we're considering. Is it a desire, or is it? Well, maybe bring that in now if you want.
Well, yeah, we have a young man, autistic, non-verbal, in our service, and we're sort of negotiating with his mother about how the quality of the care and how it's delivered. How the quality of care is maintained and delivered. And one option that exists for us is to give her access to the electronic records that we currently use. And I'm a competitor of Lock My Care, so I won't mention them. But the key thing, or one of the key things there, is consent. How do we get that guy's consent? We probably can't. He lacks capacity, so we have to go through best interests, and we'll have to come to some allow that process to work out before we can actually decide that's what we're going to do. So that's just an example.
Yeah,
really.
and it's a great example of it. Actually it showcases the layers in which actually we have to think about when we're talking about this there. However, when you think about it from a context of just general humanness, actually everyone wants to do this from the best intentions at heart in most cases. So I don't think, and whilst we have to protect everyone's interests for sure, most of the cases about actually I'm caring for my loved one. And so we have to navigate that little journey as well. I'm just going to bring it back to the panel again, if that's okay, and just think about this one idea of, the report talks a lot about confidence, and actually, I think what is central to this report is the fact that family members are no longer on the periphery of care. They're very much within the care system. There are key decision makers, and if they're key decision makers also, they want to build confidence as well in understanding what the care of their loved one is. So it suggests that actually the report does suggest as well that confidence erodes quietly through inconsistency rather than failure. So it's not necessarily a case of the failure of the service, it's just the inconsistency of how that may be, communicated, etc. And the problem is that, that sort of feeling of inconsistency can sometimes lead into other issues, and it could end up in complaints, maybe some things up to the inspector, the regulatory issues. It could even result into occupancy issues as a result, things like that. So I guess I just want to ask the panel as well that what could be the early signals or in this sort of process where families, before it goes into failure mode, that we can kind of highlight so that we can develop that family confidence. Family confidence can be built up, and are there any early signals as leaders or providers here we should sort of look out for? Maybe I can start with yourself if given the breadth of the second.
Yeah. For me, I always say pay most attention to your most difficult customer, because we label people as awkward or difficult. Actually, most of the time, that comes from, I find it often comes from fear. And I think particularly when we're talking about complex young adults, these are parents who perhaps looked after their child, and suddenly that role is now empty. There can be guilt involved. So I think having those conversations very early when you start to see the signs. So actually, are we seeing lots of entry in the records where we're talking about the family member perhaps being rude or perhaps being demanding? Are we hearing complaints from staff that they're phoning 3 times a day? They're all little signals that actually they're wanting for something that they're not getting. So at that stage, nip it in the bud. It's like early intervention. So I think at that stage, understanding what their motivation is. I mean, this lady who I was talking about, the example, I've sat with her, and I don't think her motivation is anything bad. I think she feels incredible guilt from being estranged from her mother, and she's trying to address that now. But no one's actually sat with her and asked that. So I think recognising those early warning signs, and it can be as simple as the staff saying, oh my God, they're so difficult, they're so demanding. Well, that's your red flag. Why? We're clearly not delivering something that they need. And you need to understand what they need so you can fulfil it.
That's really interesting, actually, yes. So you can almost kind of see that from the level of interaction they're bringing already, that you're not meeting a need. I don't know, maybe from a practical, Laura, have you seen?
That's really interesting way you put it, actually, Catherine. And I'd go one step further and say we sometimes receive referrals, and I don't think we're alone, from the local authority, where they are telling us that this person has a difficult family. So you're almost setting them up. And I agree, I think those people that come with all of the baggage, everything that has led them to acquire that label, it's not because they're waking up every day thinking, all right, whose life am I going to ruin today? They're trying to advocate and do the right thing for their person. And I agree, it's about finding ways, whatever that is, and it could be something different for each situation, to actually get that person around a metaphorical table, to get them as part of the conversation. And we've done some sort of really, probably not so radical now, but a few years ago, a radical thing we did is we asked family members to come and sit in on specialist training for people with complex health needs, so that they could be part of that delivery, but also hear what was being shared with the teams as well. So that's putting everyone on the same team, because we all want the same thing for people. So I think it is those quiet signs, it is the phone calls. It's actually another one can be sort of slightly sarcastic comments on social media.
Yeah.
Okay, where's that coming from? Something lovely that's being shared. Well, my person's not out, or it's those kind of slightly unpredictable thing. So I think it's about having eyes and ears and being receptive to it, not just ignoring it and thinking, well, I'll wait till it becomes a really big issue and then I'll deal with it. Let's get in there and have those conversations sooner.
Do you know one thing I think that Lara does really well? I'm sorry to call you out on it,
Oh,
but I think in terms of when we're talking about those, we know you do that well. But in terms of like leaders being embedded within the service, because I think one thing that I admire about Lara is she's fully embedded in that service, and you're not going to see the signs unless you are physically living that day to day, I think, and having that input as a leader and not just relying on the kind of traffic lights and the things coming up to you. So I think, yeah, as a tip, I would say as leaders, you definitely still need to be in there.
Yeah, so I think there's an emerging point there in terms of let's not wait till the problem arises. However, if we're trying to embed this into our workflow, maybe in terms of the way that we actually really run our service and actually do it proactively rather than reactively, what could we do which is proactive so that we can almost envisage, more proactively that if something's happening before it even goes in there? Martin?
It's stating the bleeding obvious, right? So it's often not an issue of communication, it's an issue of process. You've got a system like Log My Care that prompts people to an agreed cadence. It doesn't solve all ills, but it gives you a fighting chance, I would say. Yeah. Because, like I said, delivery of care is messy, it gets forgotten, and there are lots of good reasons that happens, but none of them are particularly good reasons for the family member on the end of it not getting the communication. So there's something about getting your processes right around this, and sort of building on the points already made but articulated much better than I'll do it. It's doing it early. All too often a communication plan with families comes into being when the relationship is already in a tough spot. So there's something about agreeing up front what that needs, respectful of the individuals we support and with their say so, and in full cognizance of GDPR and all that. No, and I'm saying that jointly, but I agree. No. Your Honour. So with all of that, but agreeing with the family member what that's going to look like, and having really honest conversations around, we're going to stuff this up occasionally, and building the relationship so when communication doesn't happen, or you hear about something that's a negative, as opposed to 8% of people are only hearing about negative. You've got that body of work that's the backdrop to, and it doesn't create as much angst necessarily as it would normally.
Agreed.
Just add on this as well. For those of you who are using a family portal or something similar, or who are considering it, I think there's something here as well about letting some of the technology do this work for you. So are there families who are never logging in? Can you check how often people are logging into this system to have a look? Firstly, are they logging in a significantly higher number of times per day than anybody else who's using the system? I'd suggest that they're probably not particularly confident in what you're doing if they are having to be repeatedly and routinely checking much more than anybody else as a family member. But also, have they literally never logged on? Maybe they logged on once and set up a password and it's not again. Those might be people you want to proactively reach out to. Let the system flag it to you. These are unusual users of a system. And it might be for your never logins, it might be they're actually absolutely fine, breezy, or they're visiting in person every day and so they don't need to see a digital system. But it might be that doesn't work for them as a communication platform and they feel like you've just given them an app login and told them to just go away, basically. I'm not saying that's the reality, that just might be their perception, really worth checking. And if people are really frequent users, I wouldn't recommend reaching out and being like, so I saw you logged in 20 times yesterday. But might just be worth, next time if you know they're visiting or if you have another reason to call them, just check in. Let some of that system give you the data rather than you having to worry about just hearing it from frontline all the time.
That's brilliant. I think we're going to go deeper into that point actually in a second as well. But before I do that, I always bring one contribution from the audience. I think, Daniel, your hand's up at the moment. Don't forget a mic there. It would be great.
Thank you very much. Daniel Casson from Casson Consulting. I actually put my hand up just before Lara started to speak, and she started down the road that I wanted to ask especially Lara and Martin about was, we're talking about involving families, we're talking about involving people who draw on care and support here. Where does, I'm actually delving into the word of co-production with people, even at an earlier stage than we're saying involve them when they're there. Isn't there a role of co-production in what sort of technology is actually being introduced as well. So taking it back that nothing's a surprise because the technology that you're working has been designed with the people who it's there to support. So even going back a slight further step than you did, Lara, in your original talk, and Martin the same, about when someone's coming in, about that co-production piece being part of technological development.
Daniel, thank you for that. And actually really brings in a nice segue into this next point, which is actually, we touched upon it so far, 2 points. We talk about families being partners in care. And if you really have a partnership and you really want to consider a partnership of care, what does that really mean? So I'd love to just delve, if you don't mind, putting some thought to that. The second thing is, when you talk about co-production and the role of technology, it's been highlighted already here in terms of that. Ultimately, one of the key points that came out of the report was about reassurance. Visible reassurance. And we know that technology has an opportunity to play a role in this, but at the same time, we also know that does it also bring in scrutiny? Maybe it also brings in some issues where the care teams feel overly looked at or gazed upon. Bringing in this sort of operational realities to where we can develop great partnership in care. I'd love to explore that further, taking on board also Daniel's point there. So if I can open it up, anyone may want to start on that point, more than welcome to. So partnerships in care, and maybe where technology is actually being able to do that as well.
Sure. I'll start. I'm sure everyone has something to come in on this. I think, if we're talking about technology in care just for tech's sake, we've already gone completely off-piste at the end of the day. Whatever sort of technology you're using, you need to be thinking, okay, what's the outcome we're trying to achieve? What is the challenge here? What are the values that are driving it? And that should be, then, if there's a technology that meets that, that puts you in a really good place. You're kind of then thinking about your outcomes. You're not just going, we're going to digitize this process. You're not getting buy-in from your staff from that. You're not getting buy-in from any of the people you're supporting. You're not getting buy-in from families. So once you've sort of outlined, so say you say, okay, well, we want to improve our transparency and our trust with the families that we're supporting. I would, at a really early stage in that, then sit down with families and say, this is what we are thinking of doing. This is why it's important to us, and also to the people you're supporting, maybe together or separate conversations, depending on your service. You'll know what makes more sense for you. Because at the end of the day, these are the people who are going to be using it. There's no point making a decision as a leader for a piece of technology that you are not going to be the person logging into every day, right? Like, you want buy-in. So I think co-production in that case is really important, because then if you've got some families who are really on board with this, they also then can be peer champions of a piece of technology in your service. They can say, well, we were involved in making a decision about this. They were listening to us. This is responsive. We really feel this has come off the back of our needs. And I think then you're immediately starting with a culture of being like, we're working in partnership together. And in any kind of technology, whatever you're choosing, something from the most innovative to the most basic, it's the cultural change, which is the hardest part of this. And if people don't understand the why, Richard's special page in the report, all about the why, right? If people don't understand the why, they won't use it, or they'll use it poorly, or they'll use it for a little while and then switch back to previous ways of working. And you'll just spend a lot of money on a piece of tech, which is completely useless for you. So the partnership goes all the way through to choosing, right? It's not just a partnership to say, we've done this, here you go, logins.
That engagement, though, I think when we're talking about co-production, you have to get it right with the staff as well.
Yeah.
Because I always say, and it used to annoy me so much when I was in CQC, if you've got a system that you're not working with and not working with, that's worse than not even having a system. So actually, I think that engagement and co-production right at the sort of front end with staff, families, everyone who's going to use that technology is really important. So it's not easy to use. If staff are scared of it, then they're not going to use it, and that's going to cause you more problems down the line. So I think that engagement early on and myth busting a lot of the time. Yeah. So they're not going to see every word that you write, and this is why we're doing it. I think is a really important part of it.
Yeah, absolutely vital to have that conversation with staff as well. Especially, the report's really clear, right, that people want to hear from frontline staff who are providing care. That's what's most meaningful. It feels quite vulnerable. I think it's already been described to sort of open staff up to that. And so actually making sure as leaders we feel comfortable and confident in that, and also that staff are supported in that is going to be really vital.
And can I maybe just delve into in terms, because I think this is great, because we're talking about this co-production, and particularly around how we communicate. But this idea of partnership in care, What does that really mean? What does partnership in care really mean? If you give some good examples.
Shall I go?
Please.
It means what it means to that person, doesn't it? So I think we can talk about what we mean by a global partnership in its broadest sense, and that's working together to provide the best outcomes for the person receiving support. But I do think that we can get hung up on why we're doing it. So what you were saying about why are we doing it? We have to know why we're doing it. And actually, I'll go back kind of a couple of stages of why do we document everything that happens in social care? Because if it's not written down, it doesn't happen. That's all drilled into us. But why do we do that? We did it originally because that was our way of being accountable to our commissioners and to our regulator or enforcer, depending on who
Wasn't an enforcer.
So I think we have to look at why we're doing it. And actually what we have now is the opportunity to turn something that was around accountability of what we were doing and making it a really exciting opportunity to be able to share that information with families. For me, I think the co-production is so important because otherwise there's that fear that families don't trust the system, particularly if people have had 2 or 3 bad experiences or they've had a really rough time at school or they've, whatever those experiences are, so they can have that mistrust, even though you've done everything really well from the moment you've met them. So I think it's a really good opportunity to get those conversations going. But something I think is the next big step is actually hearing the voice of the person far more, and actually, and I say this word with advisement, allowing them, and I don't mean that in a paternalistic way, but actually them documenting their own days, which is something we're trying to look at trying to use as part of that partnership so that they can document their days. And of course, we're not in a vacuum in social care. A lot of the guys we support now have got their own phones, so they'll be phoning or texting or WhatsApping family members, but they might not be getting full information. So it's about understanding exactly what families' expectations are, back to those needs of the individual, and making something happen that will meet all of those needs, and keep reviewing it as well, because things change and people change their minds. So I think it's a really exciting time to take something that was quite mundane and boring in terms of documenting data and creating a narrative and a story for what people are doing with their lives.
Amazing. Mark, did you want to add anything at this stage, or?
I'm okay.
Yeah, okay. Perfect. Just make sure we had partnership here as well.
And I had the right to choose not to.
You do have the right to choose as well, so we're just displaying that. I'll consent. I'll consent to acknowledge your consent. I think, look, the role, as we say, that the partnership aspect is when we talk about personalised care, and we talk about that a lot in terms of actually how do you do person-centred care. Really also that means how do you have relational care in the context of not just the individual, but the entire ecosystem around that individual as well. And that will be, as I think is being highlighted here, is that if you need to have a conversation early on, it may be different for different people, and how we design services, etc., will be based upon that relational care that we actually develop out as well. So it's pleasing to hear that that's happened, but also that does sometimes cause complexity at the front line, right? Because ultimately they are now having to manage multiple different types of engagements. They're being called upon, because actually what was also highlighted in the report was the fact that frontline, they would like to hear from the frontline teams the most, right? And that also brings out some operational challenges ourselves. We know how that works. They're busy people. They may not also have the skill set to be able to communicate well with families, and then they have to manage all these different sort of personalised channels. So there is something there where maybe technology can help system. I think you mentioned about some sort of cadence and building that up maybe with systems, etc. But I'm going to just bring 2 points here very quickly. First, can I just ask, just going to show of hands here again, how many of us have actually sort of put some sort of digital solution in place to help with this at the moment, or any type of digital solution in place at the moment? So you have a digital solution in place, the running of the care service. And how many of you have actually got a system that could, even if you don't use it, actually develop a nice communication with family? Okay, so there are tools there which you may have, but you may not necessarily use them. Yet in the report, it talked about 83%. I think that was a statistic. Let me just make sure that was right. 83% of people, they would like to actually find that it's important that providers use modern digital tools. Now, the reality of that is that we know where the consumerism, Sam highlighted that as well, in our daily lives, in your own daily lives, we're using so many different systems. And yet, when we come sometimes into care, we're going back to a system that we're kind of feeling a bit alien. In fact, it was even highlighted the fact that those that are coming into the service to get the support are also now with the expectation they can use their own technology to communicate as well. So I guess where I'm bringing a little bit, if you can bring some insight into this. One is from an operational perspective. How can we empower our frontline teams to do what effectively there's an expectation to build some visibility and confidence around that? And also what are the challenges around that? And also how have you got some good examples where technology has played a role, where they can actually really do that and help navigate that better? I don't know if anyone wants to.
Yeah, again. So I worked in the NHS in the early part of my career, and I introduced, much to the horror of the medical division, open visiting, because we'd had a lot of complaints about visibility and waiting for staff on the phone, people not answering the phone. The core of it was communication. And the horror amongst the staff was just, they hated me. But after about 4 weeks, they loved it. Because what they were seeing was they weren't seeing that queue of people at the nurse's station. We almost eliminated complaints completely in terms of communication and staff availability. So I think myth busting and getting rid of that fear is an important part of it, because I'm sure that a lot of people who put their hands up and said we've got a system but we're not using it, some of that is going to be based in fear of what if we get it wrong, what if the staff put something on there that I don't want the family to see, what if the regulator sees it and then makes a judgment on me about it. And I think working through some of that fear and those problems practically and seeing it as a real opportunity. Because when we look, we're back to a regulator, because I love a regulator.
Yeah, bring the regulator in, go for it, go for it.
When we talk, a lot of the questions I get around are around outcome measuring, because we've got this lovely quality statement that says outcomes, how are they measured? And everyone kind of goes, well, we have this many falls and we have this many complaints. This is a massive opportunity to measure outcomes. It is a field, of information that you can use to measure outcomes of your individuals in your services. How well are the families engaging? Do they feel well communicated with? And it also gives you a very, very good heads up before things start. It's exactly why you do staff surveys, because you want to know what the staff are going to say when the regulator or the local authority come in. It's exactly the same premise. If you've got that open communication channels, it's much more likely that families are going to come to you and say, this is my problem, and you can nip it in the bud and fix it early. So I think seeing it as an opportunity and myth-busting some of those fears is probably one of the most important points to make it work.
Interesting.
Yeah, I absolutely agree with that. I think it's going to be so important. And I think for me, if the expectations can be pushed more onto frontline teams, the best way to do that without sort of increasing their burden is to use the data inputs they're already doing as part of their care. So, if we can open access to parts of the digital care record, they're already inputting that data every day, right? And then families can see it. That takes some of the burden from the team from having to do additional data, add additional paperwork and that sort of thing. So then you open up think, okay, well, is the quality of the information they're putting into the system okay? If we're just opening up with consents and all your permissions in place, the digital care record, can we trust what the staff are putting in there? Now, might be sort of a little bit controversial and suggest if you don't, then you've got much bigger problems at the end of the day. We need to be professionalising our staff team to understand that the quality of that data isn't just them keeping a record to say this is what I did today at work. That actually is information which increasingly we can use in a predictive way. A lot of the software systems we're using can actually flag if somebody is deteriorating, if somebody's had a change in behaviour, which might indicate a problem. If we're not trusting this information our staff are putting in, we can't trust any of those flags that can help us actually be more proactive in the care and support we're providing. So if we're actually then going to trust our staff to be accurate recorders of, the care that somebody is receiving and the state in which they are in, we should be happy to be transparent with that, with their families, with their communities who need to be part of that. that's a huge task. I do understand it. It's a lot to put onto our frontline care teams, but I think we need to see this in a bigger picture about where the digitisation of the sector is going. Very soon, the government's already building a social care interoperability platform. We're already talking about data sharing. If we can't have confidence ourselves in our data, how can we have confidence in opening that up to the NHS and to local authorities? This should be part of that same sort of holistic conversation you're having as a service about the quality of the records you're keeping.
And I think on that sort of readiness question, in terms of opening that up to other stakeholders, I think I'm an advocate of not letting the perfect be the enemy of the good. Because if we're trying, obviously we don't want to lead with our chin and scare the living daylights out of family members because it's so inarticulate and scary what we're writing and recording. But like there is something about a bit of honesty and warts and all, and let's work through this together. And again, creating a psychological security and safety for our colleagues that if it isn't exactly right, that we won't jump all over them. And like, if we've got that work to do, and often we do, right? So how was Billy's day today? Billy's day was fine. For no apparent reason, he presented challenging behaviour and it wasn't very good. These are good people trying to do a good job that need some support around this stuff. So I've got no problem doing it out in the open as families that have got skin in the game as a stakeholder that might help. The responsibility on us as the employer, obviously, but that might help us get our colleagues to where they need to be as well. As we wait for the perfect, we will never share this stuff.
Yeah, that's brilliant, and I think that's just really where we're getting into in terms of the idea of how sort of that comes into play in terms of the fact that nothing should be different in terms of what we do on a day-to-day basis in terms of workflow, what we should be recording, should be just as transparent as what we could share elsewhere as well. And if we bring any friction in that mode, then fundamentally we're doing it injustice and we're effectively creating the wrong problems when they don't need to be there as well. We're going to move into a little bit more into the audience part. So I'm going to ask, I know that there's a lot of people that may have some questions as well, but before I do that, because I'm a technology enthusiast myself, and clearly it's always there, I just wanted to get a sense and gauge. We talked, the report also talked about 82% are very open to new innovative ways of technology as well. And we haven't even touched AI yet, and I'm not going to bring that up properly because it's a big topic anyway. But just to get a sense of the room from providers, how many of us actually see AI to be a positive addition to delivery of care? So it will be actually enhance our care going forward. That's brilliant. Amazing. And how many of us are probably more find it a bit of a risk, a bit more concerned about AI and actually the parameters and the fact that there is more to it than it could have.
Can it be both?
I was
hoping both hands would go up as well, to be honest, so you can do it. So there is an element of measured application, but we also do see the positives of sort of new innovation in technology. And the fact that those hands came up quite quickly shows that there is certainly something that can be done around that. So I think there are more questions on this, but and while we're doing those questions, if you can build on a little bit of this as well, that we've got some great senior leaders in our team at the moment. Ultimately, if family confidence is one of the big parameters that we really need to kind of work on, what should we be measuring as a senior leadership team? So if you keep that in mind as well, as one of the questions, and any other questions that are from the audience. Does anyone would like to ask a question at the moment? Yes, sorry, yes.
Just reflections, really. We have installed a huge digital system, I won't name it. It has the capability to have family involvement. But for me, it's about going right back to the home culture and saying, what involvement does the family have without tools? What is the culture of the home? How are people involved in that service development so that can happen on an ergonomic platform? I used to work for Carers Trust, so signposting people to support is huge. That could be another avenue. People feel very vulnerable making that final decision. There are steps to get into services. So, we talked about training, peer support. There's so many elements to this that can be, exposed and utilised. And again, I'm very passionate about people coming into care. I retrained at 40, but there are a lot of young people out there who could see the digital aspect as an attraction to care. But going into the fee side of things, we can't pay them national living wage and expect them to come in and be all of those things. I did train in relationship-based care, and somebody once said to me, can you be a friend to somebody that you're caring for? And I said, absolutely you can, but there is a piece of silk between you and them that you don't cross when you are a professional. But having that much insight and sort of life experience to be able to manage that situation professionally is something that has to be trained, it has to be discussed openly. And for me, that's an additional resource that has to be factored in. And the more we ask our staff to do, the more professional we expect them to be. There has to be, a career path which is there, and I've exploited that to the nth degree, but been very lucky in that. It's not there for everybody yet. And I think we just have to call it something completely different, other than relationship development partner, perhaps, rather than care worker, which has, because there are huge interests for young people in AI and digital, in supporting people to have access to services. It's just about branding it better and paying it better. And I'm looking at Professor Green because it's a constant. I can feel myself getting hot because of the conversations we have this week about this. There's no recognition. There is no, which is quite difficult to take when you've in a room full of such enthusiasm, and potential. It's really exciting, but it's, getting from A to B is still a big challenge, isn't it, to get where we need to be.
Absolutely.
Thank you for today and all the information.
Brilliant. Thank you for that reflection. And to be fair, as you say, it is the case that there are multiple hats that someone needs to wear in that role. And actually, we're expecting maybe a lot from our teams, but that expectation is not what's the word I'm looking for? It's not unjust in some ways, in the sense that actually this is what relational care looks like. But how do we actually bring the frameworks around that? And some of that comes from the top. How do we build a culture that actually gives the ability for that sort of level of, relational care come into play, partnership in care? We'll build that family confidence, knowing that actually it is all together. So, just building on what was shared just there, maybe just bring it back to the panel in terms of, from an organisational, we may have boards here, we may have leadership teams. What should we be embedding in bond in terms of culture, but also some of the things we should be measuring to help build this family confidence?
What typically, and all organisations are different, right? But typically the things that end up going up to board are looking in the rearview mirror and they're already, it's too late in terms of the communications falling down or the quality of support isn't there. So it might turn up an occupancy, it might be the number of complaints. I tend to view those as a positive, so that's probably not the best example. So those things are always looking in the rearview mirror, and I think there's an opportunity to work with boards in terms of the sort of data and KPIs that they get around how are we proactively reaching out to families. So have we, and I know these are inputs rather than outcomes potentially, but I'm trying to move away from these lagging indicators where it's too late to something that gives you a little bit of a heads up that things might be going wrong at the board level and you can do something different. So there's something in like surveys, pulse surveys, avoiding survey fatigue. Well, stop asking us again. Come on, just do something about it. But there's something about, is this a place that you would recommend for somebody else's family member to live? Something about that. There is not reactive measures, there are proactive measures in terms of how many family meetings have we had, those kind of things that I think try and get you ahead of some of the outcomes of not doing this well.
I agree. I think being reactive, you're always in a bad spot, aren't you? If you're worried about people viewing daily records, you've got bigger problems because we've got to stop assuming, and I get quite riled up about this, that our workforce is an incredible workforce. They are professional. And we get fed up as a sector when people looking in on us refer to us as being the unskilled workforce. We have such extraordinary people working, and our job as leaders, as senior people, is to empower those individual members of staff to have the confidence to know that what they're writing, what they're documenting is fitting with the culture of the organisation. It is absolutely what they should be doing. And yes, things may not be okay some days. They may write something in a clumsy way, but let's not annihilate that person. Let's sit down with them and learn from it together. And I do think there's, for those colleagues that work in settings where there are days where things don't go well and we see some challenging behaviours, or behaviours of concern, the whole debrief process, we do that when things aren't going well. And actually, we need to be doing that when things are going well as well, to say, look, this had a really good outcome. Because we were doing this landed really, really well for this family. But I do think there's some real basics as well. Are you looking at what was there, Vishal?
No, just realised. That's fine. Keep going. Just,
real basics about agreeing shared language as well. So for us in our organisation, we start that from day one. And we actually give our inductees a bingo card of words that we will not accept as an organisation. So, and it's unique to us, and this is not me trying to offend other people, but we don't like being people we support being referred to as service users, clients. We don't like people going into the community. They're going out, they're going to the pub, they're going to the town, they're going to their job. So we have this whole bingo thing, so that from day one we are giving the very newest people that are coming to join us and work with us the ability to say, hang on, you're my team leader and you've just said something that's on here. So we're trying to change that culture of you're last in, so you've got the least to say. And just that accepting of professionalism and language is so important. And I do think that AI can actually be a really positive way, because we've got, I think we worked out one day that there's equivalent to 100 pages per person per week that we're creating, and that's just on a standard week. If you've got AI that can search through for some of those words that you know could be the early signs for that negative way of reporting, then we can use that and go back and look at retraining people or having conversations with people about using better language that suits the culture that we're trying to create. So I get really passionate about language, in case anyone hasn't noticed.
Fantastic. Look, we are actually coming close to the end of the hour. It's gone really quickly, actually, and there's been lots that's been discussed as well. I'm glad that we had some contributions from everyone as well. So just a final thing, if there is one word or a few words that you want to say, just as a final message, I feel, family confidence, the fact that the role of the family, we've really discussed quite a lot, and it really is central. It's not on the periphery. It is core to what we do, and how we engage with that is really important. But any final lasting leaving comments that you may want to make?
Of course, mine's going to be regulatory, because I don't want to see anyone when they've got a notice of proposal to close. Before this, and in preparation for this, I looked at 20 reports, random, that were rated as inadequate and responsive. And I was shocked, because in 18 of them, family communication featured.
Oh, there you go.
In responsive. So, if that's not a driver for you to get it right, and touching on what Lara said, some tips that have done well, because I think I have something useful to go away with. Where I've seen it go really well is leaders and executives having an open dialogue with family. So whether that be a person's story or a family member's story at the board or the senior leadership meeting, that goes down really well and it keeps people appraised. And also it looks very good to externals, which is a bonus. The other thing is surgeries in your services. So actually physically going into the services and holding surgeries so that people can drop in. And the last thing that I've seen work really well is a generic email address that one senior leader mans every week, so that family members and people who live in the services can actually email that line and get a direct line to someone in the senior leadership team.
Access, which is amazing. Brilliant, thank you for that. Just any final comment?
Yeah, I think the point there is really well made. So there's something in there around data we provide to people and up to board. I live quite close to North Staffordshire Hospital, which didn't have its troubles to seek and had a big investigation. And one of the things that always sticks with me is that the board and people up and down that leadership chain, I'd become blind to what was actually going on to the individuals because it was all about numbers and data and information. And I think there's lessons to be learned from that. Into board, those stories, the actual impact of when things don't go well, not just numbers. We've had 7 never incidents. Yeah. That would be a lot, right? So there's something about board, but also like in terms of the communication to the families, it's not just around the big, massive objectives that you're working on, the big showpieces. It's like communicate around the day. He's actually having a good time and smiling and having fun alongside somebody he lives with, or he's out. Not in the community, just out. Having a great time. So there's something about that communication, about just the gloriously ordinary life. It doesn't have to be a big showpiece. It's the stuff you support workers are doing every single day and just lighting people's lives up with that we should be communicating as well.
Brilliant. Stories it is. Let's make sure we share those. Final last comments?
People need people, and we are really lucky that there are organisations like Log My Care that are creating tools that are enhancing what we're doing, and we should be really biting those hands off and working with organisations that are listening to us, listening to families, listening to the people we support, maybe listening to commissioners and the regulator. I don't know about what they like to see. How often do they come in and help us? I don't know. But looking at that relationship between all of the people that are stakeholders within that, and using this superpower that we have to make social care even better than it is.
Let's lean in. That's what I heard there, so it's brilliant.
Yeah.
Okay.
Yeah, and I guess I'd say as well, let technology help you. As Lara said, there's so much great tech out there. There's people like Log My Care who are doing amazing work in this space. Let the tech actually be a support system and help in a busy day. But remember, it's not one and done. You don't get to just put in a system and be like, cool, no more training, we're never talking about it again. The technology, the whole process of it is part of that conversation, and it is one of the tools in making sure you're having really good relationships in your service.
Brilliant. Well, can you all join me to thank the wonderful panel for their incredible insights?